Welcome back to Lafayette Lifestyle. This is Robbie Breaux. I want to welcome you guys over to Lafayette Veterinary Care Center. As you know, during COVID-19, we've had some things that have gone on that are a little bit different down to normal, but one of the essential businesses that are happening is how to care for the pets and what is happening and how is that taking place. We have Dr. Marc Bordelon with Lafayette Veterinary Care Center. Thank you so much for visiting up with us, and give us a rundown, man. I know this has been really crazy. What's going on here now at Lafayette?
Okay, sure. First off, thank you for having us, and we appreciate having some information that we can impart to the Acadiana area, but hopefully to everybody. As you know, any kind of sicknesses, whether it's from humans or from animals, it just doesn't stop because there's something else out there. Diseases continue to happen, and preventive care still needs to happen so we can prevent other diseases that we have under control. So at Lafayette Veterinary Care Center and really a lot of other veterinary hospitals around the nation, we've had to change our protocols. So what that means is that we are, like you and I are doing right now with the masks and social distancing, we're trying to follow what the CDC is recommending to decrease transmission of this disease and just make sure that we're doing the right thing, making sure our clients feel safe as they bring their pets in for care. So one of the major changes that we've had to do is do curbside service, and I'm sure you can see several cars parked. The parking lot gets full, and what we end up having to do is have an owner call in, or if it's an emergency, they come in and say, look, I'm here. There's signs on the door of what number to call. We get as much history as pertinent as we can to at least get the ball rolling. Go get the patient from the owners using our equipment, decontaminating the pet, going inside, getting an exam performed, getting additional information if we need to. And then what we're having to do at that point is communicate with the owner either through FaceTime,
via FaceTime
or phone or some other communication that's digital to relay the information that we're seeing. If we do have to come outside, then we're doing it at a safe distance and doing the social distancing, and then getting whatever information that needs to be signed, transmitted, payment. All of those things we're trying to do is as much digital as we can. If the patient stays in the hospital, being that we are a 24-hour hospital, then they stay in the hospital and we do our communication the way we've always done it. We've never closed in the last 5 years. We've been 24/7, 365. So
you guys have always been super progressive, and
try to, yeah.
I found that it's been really nice to be able to, everything's around the clock. You've got emergency care. This pandemic's actually more highlighting the strengths that you guys have right now.
Well, look, the veterinary community is strong, and I hope everyone out there it gets through this okay. We want to see Lafayette come back strong. I mean, that's the goal here. But as a business, yes, we got a lot of clients, clients to serve and patients to serve. We have a large staff, and we want to see Lafayette come back the right way. So, just to highlight one more thing, if the pet is not being kept in the hospital and it's been more of an outpatient treatment, then as we're bringing the patient back out to the owner, we're doing our best to decontaminate them, and there's protocols that we follow that most veterinary clinics are following, and then escorting them back to the owner. So that's our protocol, and that's what's changed. We're doing curbside pickup for medications and food as well. So that's another change. And there's very, very rare circumstances such as euthanasia or really serious conversations where we will have to have a client that may need to come into the clinic to say goodbye to a pet that cannot get off of emergency services that we offer. So those are the only small changes that we're allowing clients into the building. Otherwise, look, it is a huge change. It's a big protocol difference, but like we talked about in the beginning, this is a fluid situation. Things are constantly changing. So what we're talking about today may change next week for all I know.
Sure.
But for now, that's the game plan. That's what we're doing to keep our clients safe and continue excellent patient care, which is what we strive for every single patient that comes through our doors.
So, Doc, do you have any tips for people that are staying home with their pets?
I actually do, and I did a clip the other day for kids that are, because I do a lot of class pets as well, and I'm going to repeat some of that same information because I think it's important. For children, I think more than ever, now's a good time to be invested in your pet. So often the kids want a dog, and then all of a sudden it's mom and dad that take care of it. So now it's a great time for parents to educate the children on, look, this is how much water that your baby needs. This is how much food that we need. Get them engaged. Teach them how to walk on a leash. Teach them to do maybe some commands that we didn't have the time to invest in when they were younger. And then as parents, and as the parent, I think one of the things that we really see globally in our profession is obesity. It's a huge pandemic both in human medicine and veterinary medicine. And one of the great benefits of having a dog is that it makes us do things. It makes us go on walks, makes us be more active. So for all those pets that are overweight, what a good time to get into healthier activities and healthier habits, not only for ourselves but for our pets. So, no, do the old analogy, man. You eat a little less, you walk a little more, the calories are going to shed. It just takes time. So baby steps getting there. You can't just go from to vegan all of a sudden. You got to take baby steps, right? So I think it's a great opportunity that we're given, and you got to find the silver lining in things. And if there is any silver lining in what I'm seeing now as a profession, is it's given us more times with our families, given us more times with our fur babies, and I think it's a blessing in disguise, despite all of the bad stuff that's going on. The one thing I keep thinking about is how bad this virus could be if it was affecting our pets as well. I mean, it's terrible that it's affecting humans. It's the worst thing that we can imagine. But if there's another virus out there just blowing the water, and if it was harming our pets, I think it would be vital for us to come together as a community and do something about it. So I'm really happy that we're out here providing a service, and again, I thank you for allowing us to shed some light on what we're doing as a veterinary community.
And Doc, thanks so much for having us. I appreciate you. I know it's been super crazy with everything that's going on.
One more thing I'd like to say, if I can, look, just keep supporting what you can locally. Maybe people that are buying on Chewy.com or some of the pet meds. Look, your veterinarians here, they got stuff that we can sell you to, and keep some of that income here locally. And then again, everything that you do out there, try and keep it local, guys. We got to keep Lafayette strong as we can. The only way to do that is by doing it together. So thank you.
Mark, thanks so much for having us. Really appreciate you taking time out with us to go through what's going on with the pandemic. Gang, as always, if you have any questions about the services that Lafayette Veterinary Care Center offers, check out the links below, their websites here, their Facebook, their Insta. As always, I'm Robbie Breaux at Lafayette Lifestyle. We'll see you next time.